Okay, my name is Brina Triplet, and I will be doing my health topic handout on epilepsy. Epilepsy is a chronic disorder of the nervous system. Epilepsy is basically a seizure. A seizure can be a combination of sensations, muscle contractions, and other different usual body functions, such as like your mouth can be jerked in a certain way or move in a certain way. Your eyes can be fluttering. Your arms and legs, hands and arms can be shaken, and your legs. You can also have like a staring seizure where you're staring at something for a long period of time. You can also have no symptoms of seizures. You can also have like cluster seizures, tonic seizures. There's different like between like very severe and all seizures are severe to me, but there's light seizures and like more severe seizures, if that makes sense. Seizures can also be caused by like flashing of lights, sudden sharp movements. They can also be caused by like things that also could trigger it would be like overwhelming, like they're doing something. They could be overly stressed. Like some people can have like them by anxiety or fear because they get like worked up, like if something like really works them up. Epilepsy can be in infants. It causes, the main causes, it could be a fever, brain trauma, a disease such as like a meningitis, a tumor, which is very rare, and an infection in the brain, which I said was like a meningitis, or they could have a brain disease. The signs and symptoms of epilepsy would be temporary confusion, a staring spell, uncontrollable jerking of the arms and legs, loss of consciousness, and then symptoms such as anxiety or fear, and that could work them up and they could have a seizure. What types of medical treatments are they to help with epilepsy? There's several that I know of. Would be the keto diet, which is a low carb and high fat diet, and the nutritionists, which people with epilepsy would go to, would make a meal plan for the for the child or the adult to that would help best for them with the seizures. Surgery, they could remove areas of the brain which causes the seizures, but this could also cause several complications, which you would just have to talk to the doctor about to see if it's the right thing for you to do, or you should just stick to medications or therapies. Which also medications, there are several different medications for seizures. There's diazepam, Ativan, Keppra, just naming a few. There's several more. The impact on children's learning and development. Seizures can really affect a child's development because they're doing damage to the brain, and depending on how severe they are, they can do more damage than the smaller ones. They can affect their learning because sometimes it can affect their memory and make it hard for them to do certain things daily because they're forgetting things when these seizures happens, because it's messing up their memory because it's doing damage to their brain. So it can be hard for them. And ways that you can help that child is to really work one-on-one with them and help them study, and giving them more time to complete an activity or assignment, because it may take them longer than the other child or the other person to finish that activity or assignment, including tests. Classroom and environment modifications for children with epilepsy would be longer times, like I said, to take a test, simpler activities, making modifications to certain activities, which is about the same as simpler activities, letting the child work with a partner so they can have some help. The teacher would be also helping, but that child, things will be harder for them in certain things, and having that partner there to guide them and help them could make it easier for them in the classroom. reading with a child in a very quiet area, because they, with their memory and stuff, it's harder for them to focus. And letting the child listen to a story on a headphones, like if you have like an audio book, or like they call them people have Kindles now, and I don't know if they could provide them for the classroom, but maybe they could make modifications for a child in the classroom, because audiobooks would probably be better for them instead of like reading to them, because I mean, if there's more commotion going on in the classroom, they might need the headphones. Memory is sometimes a struggle, which like I said, with children with epilepsy, so studying is very important. So like I said, one-on-one, like the parents and the caregivers, the teachers, anybody who's helping that child would try to do one-on-one and help them. And on the handout, I have provided some resources that could help. And there's also some children books online. You type in epilepsy children books, and I think they're on. I think they were on the healthychildren.org, which I put on my handout, and epilepsy.com, and then there's American Epilepsy Society website. All of these have really good information to help the parents, families, and for the teachers, epilepsy.com had a lot of information for teachers, like to how you help a child in the classroom with epilepsy. And I think these resources are really good, and I hope you learned a lot of information that you did not know about epilepsy. Thank you.